Hey YouTube, I am bringing out a video for you today on a guide to succeed your physician assistant interview. And I'm just going with everything of my experience from the top of my head on how I succeeded and excelled in the interview. So the topic today is on posture, facial expression, and hand gestures for how you present yourself during the interview. And it's a really big, important, factor in the interview because the physical appearance you have is the first impression you're giving your interviewers. They're actually interviewing you while you walking in, sitting down. That's their first impression they get is the facial expression you're making or your hands or different movement. So I'm going to tell you what to do, what not to do. And the school I went to, because every school have a different style of the PA interview on how it's set up differently. There's also, group interview, individual interview. There could be a combination of both. My interview was a panel interview with individual, but also it had 5 faculty members from the PA program, all just staring you down, just looking at you. And some schools might be like that, or some schools may have one, and they're still just staring at you with maybe just a nonchalant face, zero expression, or maybe, a happier, cheery way. But most of them are just ready to just jot you down and make sure like they're finding, a fault. They're looking, I guess, for faults. But of course, you don't want to show you any faults. And honestly, everyone is going to be nervous. You're going to be nervous, but you have to just get into your skin and feel comfortable after a while. And that's what they want to see also. And the first thing you want to do is have great eye contact. Where my panel interview of 5 faculty members, each person would ask a question and it'll be a different topic. And once the person asks a question, I direct my attention to the person. But I'm also looking at everyone else. Eye contact had to be good. As long as you're listening, it looks like you're listening. They want to know that you're also going to do that for your patient, where you are listening. Your communication skill starts with your eyes. Are you directing your attention to the person? Are you directing your attention to the crowd that you are being interviewed by? And so I made sure I looked at the person who's, representing the question. And since it was a panel of 5 faculty members, I also glanced, looked around. It don't have to be, I guess, straight to somebody's eyes because you may feel nervous. You could look at someone's nose or forehead, or as long as you're just looking towards them, they feel that, yes, this person is listening. This person is being open. And that also shows that you're open. And hand gestures is the second thing. One hand gesture that you should not do is the folding of your hands. Like you're praying, you're there looking for guidance, but of course that is something that you would love to do. I would want to do that too, but this actually shows in an interview that nervously, or I guess more of an introvert in a way. You're just tense. Don't do cross your hands, but you can, leave it out, tap your finger a little bit, but they want to see you're open. So when if you have your hands on the desk, which most likely you will, or if it's a chair and you have, let's say, a portfolio or a little binder, you have it on top, sitting on top like this. Or, of course, you can bring your hand out when you want to give emphasis on something you want to emphasize, explain more. You can, of course, don't overdo it, but you can move your hand a little bit like that to convey an idea of what you're saying to the interviewer. And also shows that you're sure of yourself and you're comfortable. And honestly, moving your hand a little bit make you feel more comfortable. And another thing is the crossing of your neck is something you should stay away from. Maybe you can just honestly just put two of your feet on your floor and stay like that. If you feel a little nervous and the tapping of your foot can make you feel comfortable, you can do it for a little bit. Don't really stress it. Don't show it too much that you're like in a tap show or something. Like you're just trying to make yourself feel more comfortable. And that's what they want to see. That ultimately, that's what they want, is to show that you are not nervous anymore. Not throughout the whole interview, but you're getting into your skin, you're communicating well. And once you have that down packed, it's actually you're 50% done. In an interview, you're 50% done. And I hope this helps. And you can leave a comment if any question. Okay, bye.